Hello and good day, everyone. My name is Sarah Hemming, and I'm a senior level nursing student at Lander University. I'm also a member of the Lander University Honors College. Both of these programs have been very influential to me in this research process. I'd like to start by saying thank you so much for your interest in my literature review. I appreciate you taking the time out of your day to access my presentation, and I apologize for not being able to deliver it in person. My hope for this collection of research is that the content will be of great value to you, whether you work in healthcare or nursing education, or whether you just maintain an interest in the treatment of burns. Hopefully, this video will be both informational and inspirational to you. Starting off, as it said under the introduction section of my poster, burn wounds are a very common form of injury in the United States. 2 years ago, when I first started looking for articles about the various treatment methods related to burn care, there was a much slimmer selection of material available. Currently, the gap that exists in burn care research has been drastically reduced in terms of physiologic interventions. However, as healthcare providers, our responsibility extends far beyond keeping a patient alive. We need to help them to reach their full potential as described by the Newman Systems model so that they can experience the maximum quality of life following these often severe injuries. Yet, research that explores other dimensions of healing, such as psychological, emotional, and spiritual, are still understudied. This review aims to identify the best methods of promoting multidimensional healing in the context of burn recovery. Several articles were considered for this review, but ultimately only 9 articles satisfied the inclusion and exclusion criteria. All included articles were retrieved from either CINAHL or PubMed. On this poster, you can see that the results section has been broken down into subsections based off of which domain of health is the most directly related to each article's findings. But it's important to recognize that all of these domains are interrelated. Therefore, many of the presented results have effects on multiple categories. Major trends revealed in this review were that a person's capacity to cope is largely based on their personality. I found this interesting because personality is an intrinsic factor that people have from the time of birth. While these traits can gradually change over time, this implies that some people are naturally predisposed to better coping. This study found that spirituality and extraversion combined with low neuroticism allowed for the best psychological adaptation. According to Britannica, neuroticism represents the degree to which a person experiences the world as distressing, threatening, and unsafe. In this review, I included 2 phenomenological studies, one with an all-male sample and one with an all-female sample. The male-only sample continuously illustrated coping and the healing process as a form of fighting, and avoidance was found to be the most harmful coping strategy utilized by these men. I will return to discuss the second phenomenological study later in this video. Positive results were examined in relation to both physiological interventions which were addressed in this review. These interventions were the use of fish skin xenografts and photobiomodulation. Both of these were correlated with increased rates of healing and patient comfort. In the sample population which received the xenografts, there was a 0% incidence of infection or rejection in the sample, and the only reported issue was a fishy odor that was mildly off-putting. Photobiomodulation is the application of light to interact with different layers of the skin. 658 nanometers was the frequency utilized in the study, so it was between red and orange on the color spectrum and interacted with tissues in deep parts of the dermis. This treatment was found to decrease sensations of pain and itching and accelerate the proliferation of cells which are necessary for the healing process. Results in the social category were drawn from Muhib and Kamal's all-female phenomenological study entitled Interpersonal Relationships, Psychological Effects, and Coping Strategies Among Acid Burn Female Victims. While this article is less generalizable than others due to cultural differences and the setting of abuse, It provides a much-needed perspective due to the fact that burn wounds can often be a result of interpersonal violence. That being said, the results of this study show that the sample identified a sense of lost identity as one of their primary sources of distress, which led to their avoidance of social settings. The phenomenon known as looking-glass self was also revealed in the study, where victims essentially viewed themselves in relation to others' responses to their deformities. This could indicate a unique form of body dysmorphia. The study also identified suspiciousness as the most negative factor from the victims' perspectives. This was described in the study as follows. When people from your extended family think that you must have done something for which you have been victimized is the most distressing part of victimization. In one case, this led supportive family members to cut themselves off from others who antagonized the victim. Initially, victims used primarily emotion-based coping mechanisms, eventually transferring to problem-focused coping. Similarly, the data also indicates that over time, upon unsolicited inquiry about the victim's facial deformities, the feelings of sadness and avoidance which victims had experienced were overcome by those of anger and frustration. My recommendation is that researchers should expand on the subject of burn care. A good foundation is laid for this, but there is still room for significant growth, especially in regard to areas of healing which are not strictly physiological in nature. Additionally, burn research should be more inclusive of the many types of burn injuries, such as chemical or electrical, since thermal burns currently account for a great proportion of the available literature. Thank you again for watching this presentation. I hope you enjoyed learning about the subject, and have a great day.